And here we are in the home stretch for Chapter 2, Immunity. This is Part 4. Once again, this is Dr. DeShavo. Any questions, hop on the email, shoot me an email, and let me know. Now, talking about immunodeficiency, and I think we automatically think of HIV and AIDS with this, but we can also have immunodeficiency, which is a primary or secondary cause in general, meaning it could be genetic, it could be congenital, there can be a drug issue, an infection, for example, so other things can cause immunodeficiencies. So by definition, makes sense, it's diminished or an absent immune response, and patients cannot fight off infections as they could if they did have a normal immune response. You can get what are called opportunistic infections. So these are pathogens that are around us all the time, and people with a functional immune system can fight them off without a problem. But people who have an immunodeficiency cannot, and it's almost like those infections take that opportunity to infect that patient with their pathogens. Now, it could be also due to a decrease in normal flora, which is the normal good bacteria that survives on the surface of our skin or along our GI tract, that helps to protect us from infectious agents. So this is the good bacteria that we find on the surfaces of the skin. Probiotics, as a side note, can help those to be more efficient and effective. Obviously, if somebody has immunodeficiency, they'll have enough of a decrease in their immune response that probiotics may not be a help, but just for a side note. This can be acute or chronic, so it can be short-lasting, such as with a drug therapy that may be added that they may change, so the patient can have a better response. An infection can be cleared up. That would be an acute response as well to something that's more chronic, such as HIV and AIDS, or some sort of genetic issue that decreases your own immune system. That'll be chronic as well and long lasting. So the human immunodeficiency virus is a virus that can affect us and eventually lead to AIDS. We're going to go through these steps. HIV is a parasitic retrovirus. So what that means is it needs cells to infect. And this virus will get into the cells and affect the RNA and have the RNA actually go back and affect the DNA. Usually what will happen is RNA gets signals from the DNA to take out to make proteins. What happens is we reverse that process, and this retrovirus, this HIV retrovirus, will actually cause RNA to go back to the DNA and permanently change that DNA. And that cell now has that permanently changed DNA, which will replicate and create more of that retrovirus, which will be released and infect other cells, which will do the same process. RNA will go back to the DNA, change the DNA, that creates more viral particles, and et cetera, and et cetera. And so it creates a permanent change in our cells. And if we don't catch it early enough and give the medications to stop it, it can lead to AIDS. And we'll talk about all those steps. So CD4 is the protein on T helper cell surfaces that is affected with AIDS and HIV as well. And what happens is it infects those CD4 cells, gives it the retrovirus so they cannot function in the immune system as they would if they were unaffected. And that's why we have a CD4 count to see how many normal functioning CD4 cells we have, which once again are these T helper cells, and the T helper cells are a huge part of our immune system. If we don't have a normal amount of functional CD4 T helper cells, we're going to have a decreased immune system because they will trigger our B cells to create antibodies in antigens or against antigens. So we have Type 1 and type 2. Type 1 is the most common strain in the USA. Type 2 is the most common strain in West Africa, which progresses more slowly. In the US, rates are rising among women and African Americans. I know that there's, once again, I don't do drugs. I joke about that, but I don't know much about pharmacology. But I know that there is a new drug that they're giving preventatively. I just saw an ad on TV. I'm not a doctor. I play one on TV. Just joking. About giving that medicine to help prevent this retrovirus from affecting our DNA. And almost acting against that and being an antiretrovirus medication. Transmission is going to be through blood and bodily fluids. So we all know that intercourse can cause it, through sharing needles can cause it. Of course, if you stick yourself with an infected needle deep enough, it can cause it, but that's pretty rare. You can get medications to prevent the progression. God forbid you do get stuck with a needle. I hear it's a very difficult series of medications to take. Tears and saliva have minimal to any of the infectious agent in it. So kissing wouldn't cause it unless there's open sores in the mouth. You guys probably know all of this, right? I'm probably preaching to the choir, as you are very well versed in this due to the fact that you're going to be dealing with people who are potentially infected with HIV. AIDS progression, there'll be an asymptomatic phase where the virus is reproducing in the cells and taking over cells, usually for several years. Acute retroviral syndrome is when that retrovirus is affecting the cells. You can have flu-like symptoms, and hopefully, if you know you've been infected, this is when the antiretroviral therapy can be used to treat people. There's a highly active antiretroviral therapy. This is when there's 3 or more medications are given to help the progression of these disease process and this infection. Infections can begin as a viral number rises, destroying those normal CD4 cells, T cells, and they can start to have symptoms such as swollen lymph nodes, diarrhea, weight loss, fever, and cough. Progression takes 3 forms. You can have immunodeficiency, where you can get more opportunistic deficiencies and infections, or any infections in general, more colds, etc. Autoimmunity is when you start to have tissues attack themselves, such as arthritis or pneumonitis, where you're going to get infections or inflammation, I should say, around the lungs. And neurological dysfunction is when you start to progress into AIDS dementia. So diagnostic testings, there are HIV antibody tests, which is a rapid home test, but obviously if this comes back positive, you should follow up with a blood test, which would test for antibodies in the blood against it, or antibody antigen testing, looking for those complexes. CD4 testing would be done with a viral load to watch the progression in response to treatment and to modify treatment within that patient's treatment course of treatment. So classification systems for AIDS if HIV progresses and becomes actual acquired immunodeficiency syndrome. So there are 2 systems. One is based on lab findings, the other is based on those clinical manifestations, and it's basically a pretty set standard, as you can see here. So CD4 cell count, you can see category 1, 2, 3 in the numbers per milliliter of blood. So greater than 500 cells per milliliter would mean you're in category 1. As those CD4 T cells start to decrease, you're going to get lower amounts of them in a milliliter of blood. So category 2 will progress to 200 to about 499. Category 3 will be less than 200. And then the viral load they'll be doing as well to see how many of those cells have turned into, the virally changed DNA cells. Clinical presentation, you can read those and they have a chart of it. And it's going to be, A will be asymptomatic, 2C is going to be the actual really progressed AIDS. No cure, combination therapy will work best. May have to change that regimen due to the viral adaptation, how high that viral load is going or not. Other vaccines can be used to help prevent those opportunistic infections, and you can vaccinate as well to help prevent infections, such as the flu vaccine. And then transmission prevention, of course, is very important as well. And if patients know that they have HIV and AIDS, of course, they should be doing as much as they can to prevent the distribution to other people. Here's a chart of the breakdown of those classifications that we just went over if you want to look through them a little more in depth. Once again, I'll test you from the notes. So HIV is a retrovirus, which means it damages the outer protein covering of a cell. Is that true or false? Is that the best definition of HIV as a retrovirus? Just a few more slides here, and we've moved on from the immune system. So outside of dealing with people who have HIV and AIDS, there are people who have a lower functional immune system. Very young and very old. Very young because they don't produce as many antibodies because they're simply not exposed to as many infectious agents. Very old because I hate to tell you, as we get older, I'm starting to look at the latter half of my life, things just don't work as well. And our immune system is not as strong as we get old. Poor nutrition. You absolutely have to have the right amount of vitamins, minerals, and proteins in the body, carbohydrates and fats, to keep balanced responses in the body. Think about it. Proteins create enzymes. Enzymes help facilitate functional aspects of the body. But we also use enzymes to form antibodies in structural parts of the body, fats as well. So if you don't have the proper amount of carbohydrates, I should say macronutrients, which are your carbs, lipids, and proteins, and micronutrients, which are your vitamins and minerals, you can't fight off infections as well. Skin integrity, we know the skin is a great barrier to infectious agents. We can get infections in through the skin. Circulation, you've got to get proper immune cells out to the tissue and clear out broken down tissues away from the tissues to keep them healthy. I'm sure all of you have seen people who are diabetic. They have circulation issues. Guess what? They get infections and they have to get, things removed. If not, removed, they have to be on antibiotics intravenously for long periods of time. Alterations in normal flora due to antibiotic therapy. This is a big one that has been in the news and in our awareness lately. Over prescribing antibiotics has created large amounts of more superbugs, but it also damages our normal good bacteria that's on the surface of the skin and the linings of the GI tract to fight off infections. So you take an antibiotic and guess what? You need another one. It's only good to take them if you really absolutely need them. So if you've been, as you know, sick for longer than 10 days and are getting worse, and it's bacterial, got to make sure it's bacterial. So chronic diseases, diabetes mellitus, I tied in with the circulatory issues, corticosteroid therapy, people who are on corticosteroids for transplants, for RA, rheumatoid issues, they'll be on steroids, tend to have a decreased immune response because your body can only keep up that response for a certain amount of time before it starts to break down, not function properly. Chemotherapy will have an altered immune response as well. They can't fight things off as well as our body is fighting off and working with the chemo. Smoking is just so bad for you. I can't believe how many students I see smoke. I shouldn't say that. There's not a ton. I don't see a ton of them. But, smoking decreases our ability to fight off infections. as well as too much alcohol. If you have more than one alcoholic drink a day, which you shouldn't be having anyway, but that actually will lower your immune system. They used to say, oh, if you're sick, take a shot of whiskey. No. Well, there's some research that say one drink can actually boost immunity. But I know myself, if I have an alcoholic beverage when I'm sick, I get more sick. I really think it lowers your immune system. And then obviously if somebody just has some sort of immunodeficiency state already, either congenital or acquired, can obviously increase their risk for infections. Immune building strategies. So these are all great things that you guys should be thinking about anyway, because I know you all work hard, and when you work hard and you have a stressful life, your immune system gets challenged. So increasing fluid intake, lots of water so you can flush all the dirty, yucky stuff out. Eating a well-balanced diet. Once again, balancing your macronutrients, which are your carbs, lipids, and proteins, with your micronutrients, which are your vitamins and minerals. Increasing antioxidants and protein intake. Protein helps to build up your immune system and your immune defenses and enzymes. And antioxidants are all those really good things that help to fight off and help your body to fight off infectious agents by making your body stronger. So things such as red, yellow, orange fruits and vegetables, really dark leafy greens, orange juice, grape juice, things that are really rich in color and are as natural as possible are great antioxidants. If you want to take a supplement, turmeric is a great supplement as a side note. It's a really great antioxidant. I'm telling you, this next one is numero uno in my book, getting adequate sleep. I used to think I was Superwoman and I could work 1,000 hours a week and I could take care of the kids and I could sleep 4 hours a night, etc., etc. When I feel something's coming on, I take a day off from work. I know a lot of you can't, but if you can, and I stay home and rest, and I'm sick for 3 days as opposed to 2 weeks like I used to. So if I can give you some advice from one hardworking person to another, numero uno is getting good sleep. Avoiding caffeine and refined sugar. So, okay, sugar I agree with. Sugar promotes inflammation in the body. If you could do one thing for yourself is limiting refined white sugars. Caffeine in moderation, I disagree with this. I think moderate amounts of caffeine, 1 to 2 cups a day, studies have shown can actually help you get started and do well. If you're downing a ton of caffeine, you're going to limit your amount of sleep, and once again, that's going to be counterproductive for your immune system. Spending time outdoors, there's actually been research done on this, where when you are outside, there are oils released in the air from trees. There's a response that your body has to the environment. There's actually, substances, believe it or not, that are released from nature that helps us to reset our stress level. And decreasing that stress level will decrease your stressor on your immune system and allow your immune system to function better. In reducing stress, meditation is a huge way to decrease stress and increase immunity. I can't remember the exact study, but I remember reading a study that said that you can almost double your positive immune response by meditating just 5 to 10 minutes a day. And we can all afford 5 to 10 minutes a day. So that being said, I should go home and meditate. It's good for my immune system. I'm going to give you the answer. It's true. Enjoy. Thank you guys so much. That is the end of immunity. Of course, there's a million other things that we could cover. But we're not going to. We're going to keep it to what we have in the notes here. If you have any questions for me, shoot me an email. I'd be happy to answer them. Thank you and have a great day.